Now we're going to move straight on to our perspective here on the programme today. And it was just this last weekend that an Israeli strike on a school in the southern central Gazan city of Khan Younis killed at least 13 people, including 6 children and 2 women. And that's according to the Nasser hospital where the bodies were taken. Another 3 were killed as a separate strike hit a house. The Israeli military saying it conducted a precise strike on Hamas terrorists who were operating inside a command and control centre embedded within a former school in the city. Now, the fighting in and around Khan Younis continuing then after, you may remember, the siege of the city by Israeli troops in January of last year, all part then of the daily grind in the city. Joining me now is Zahra Legris, who's mental health activity manager for Médecins Sans Frontières. She spent much of her time working in hospitals in Gaza, notably the Nasser hospital in Khan Younis. Great to have you with us from there today. Thanks for joining us on the programme. Tell us first of all then a little bit more then about what you've been doing, what daily life, if you like, has been for you.
Thanks for having me. Yes, so for us here in MSF France, we have 2 activities that run across 2 areas along the strip in Nasser Hospital, as you mentioned, and we also have a modular field hospital up in Deir al-Balah, which is where I am today. I manage the mental health activities across the 2 sites, making sure that mental health management and support can be integrated into the medical management of patients.
What kind of problems are you coming across? What are the difficulties that people are facing?
It's quite hard to categorize the difficulties, to be honest. They're very wide ranging, and what we're seeing is a profound impact on mental health for the population of Gaza, not solely from the direct traumatic events from bombings, grief, loss of life, and displacement, but then compounded by the deterioration in the quality of life, the living conditions, access to basic needs like hygiene and sanitation, and also lack of access to health services. So multifold and significant impacts on children and women as well.
I mean, listening to that and looking at some of the pictures that we're seeing now, that we've seen, of course, over the last year or so, I mean, where on earth do you start with somebody who's been most affected by the issues that obviously people are facing?
I think I have to come in here and commend the teams that I'm working with. I'm the mental health activity manager, but the teams of psychologists, counselors, and social workers are all people from Gaza who have a lot of experience and are amazing at managing the mental health and supporting their compatriots. But they also are living this reality themselves. So they're very well versed in managing the needs, and really the evidence shows that we have to manage the basic needs of the population, try to get them their basic support, and bring people into a kind of here and now situation where we provide psychological first aid, and manage the day-to-day of their medical needs. It's very difficult for mental health professionals to go deep into trauma and to manage chronic conditions in this condition where we do not have stability and we don't know what's happening next day.
And obviously you're working as well in a situation where even the buildings around you are in a terrible state. It's not like you're working in a modern, fully equipped hospital.
I mean, it's amazing what MSF can manage to do, and the resourcefulness of the people here at finding ways of intervening and providing resources. But indeed, one of the basics of trauma work is to show people that they're safe and foster a feeling of safety whilst then allowing people to recover from the experience they had. But as you say, if you leave a hospital and you see rubble, you don't know where the food is coming in or whether it will come in or whether somebody might be displaced the next day. It's very, very difficult.
And I noticed a little earlier in the interview, you mentioned women and children particularly affected. I mean, dealing with notably children as well, I mean, that must be incredibly hard.
It's some of the hardest situations that I've seen, or cases that I've seen, have been children who are so deeply traumatized that they're having reactions that are very removed from the situation they're in. Just yesterday, we were in a insecure situation in Al Mawazi, where our offices are, where there was an incursion in the area, and we had to knuckle down, get in our safe room, but we also received a lot of the staff members and their families who were directly hit by the tanks and the crossfire. Thankfully, nobody was physically injured, but I did a lot of psychological first aid on some of the children and women who were arriving. And one of the girls had witnessed a cousin who had been shot. They all had to run and leaving the child behind. And their main concern on arriving to safety was that they did not know what happened to him. And the basics of psychological first aid are that you bring somebody into the moment and you ask them to tell you what happened and tell them that they're now safe in as much as you can. And uh, what I noticed in her is as soon as we went through that, she was able to take a deep breath and still herself, which is something that I would have asked her to do anyway. But I think the lesson of that is that the body knows what to do. And even as a young child, she was 11, she knows. And I compare that situation to the story of a child that I saw in Nasser Hospital just a week before, who had had such a series of traumatic events. I think she'd survived 4 bombings where each one had taken away now every member of her family. She's the only surviving member. She was about to go into an operation. And at that point, she was completely removed from her emotions. She was not able to react. She was completely numb. And I think when you see children becoming numb and emotionally not present, it signifies a great extent of trauma. And we're seeing that more and more now, which is very hard.
I mean, it sounds like you're doing incredible work just being able to sit there and talking to people and trying to reassure them. But in the longer term, I mean, it's sort of a drop in the ocean, isn't it? I mean, how are these people ever going to be able to try to live some kind of normal life?
I would call it a band-aid. Yeah, these are a population known for their resilience and collective coping strategies. They've experienced a lot of different violence. They also have a collective psychology that is well able to come together, to become faithful, to share, to find some joy. They're amazingly resilient, but more and more we're hearing people say, this I can't anymore. And I think that says it all, really. I think the only way to move beyond the basic first aid, the psychological first aid, the amazing work that the teams are doing to try and keep people going, and the amazing work that people have at their resilience, is to have a ceasefire and to allow aid in, to allow medications in, and to allow the population and the health workers to build the capacity to do the work to heal.
Yeah, there is talk at the moment, isn't there, of a potential ceasefire? I mean, are people talking about that a lot there? Are people even aware that those talks are still ongoing?
People are very much aware. It's hard to know what will happen. But certainly that every little news, every little piece of hope, you hear people yelping and celebrating from their tents, even if there isn't a concrete piece of news. So for me, I hear that and I have mixed feelings. I have a feeling of sadness in case it doesn't indeed happen, but also it makes me realize that people still have hope, which is all you need to rely on to then build.
You mentioned as well the question of aid. I mean, is any aid getting through at all at this stage?
In the last week, there have been multiple attempts for food trucks and supplies that have been unsuccessful, or there's been various events that have had an effect on the population as well, not just in the fact that the food isn't getting in directly, but also that there's been violence surrounding that to different degrees at different levels, and it's a very complex situation. Um, we're lucky with some of the supplies that we can get to manage our activities, but we are running week to week in many ways. And we have to do without quite a lot. We have to get quite creative, especially in the mental health department. with the toys we use. One of the examples I can give you is that we use balloons and different things for distraction, but also as breathing exercises with kids. And we use gloves, surgical gloves now, in the absence of that.
And where does that leave your medical colleagues, people who are actually trying to treat the wounded and the injured? I mean, without aid, presumably there's a severe lack of medicine, for example.
I think that we're lucky to be in a known and large international organization where we have the ability to seek our supplies. But I know I'm not a logistician or a supply manager, but I know that they have to really push. They have to get quite creative, and they also have to look for solutions from donations and different actors. There is a sense of collaboration amongst all the international NGOs and NGOs around, and they do amazing work, the surgeons and the nursing teams and the medical teams, to manage things in a high quality way.
And just finally, very briefly, I mean, how do you manage to keep going? How do you manage to keep your optimism and your enthusiasm up?
For me, I know I'm here for a short amount of time. I'm happy to be here. I'm honored to bear witness and to speak on these things. Um, I can only think about my colleagues really who don't have the opportunity to count down, to know that there will be comforts at the end of 6 weeks or 2 months, that who come to work lifting people's spirits, hearing people's stories, and bearing witness to their needs and doing their work really well when they've also come from a tent, uh, experiencing an extreme lack of human dignity themselves. So they're
That's
the
how you
real
manage.
heroes. Yeah.
Good to have you with us on the programme today. Thank you very much for talking to us. Zahra Legris,
Thank
Mental
you.
Health Activity Manager for Médecins Sans Frontières, joining us there from Khan Younis in Gaza.